Stands for Community Organized Relief Effort, which has so far tested more than 3.3 million people across America for free, with plans to offer vaccines in the months ahead. And joining us now, the co-founders of CORE, Academy Award-winning actor Sean Penn and CORE's CEO Ann Lee. I appreciate what you all have been doing, especially in light of what the government has not been able to do or has chosen under this president not to do. Let's start with testing. And Ann Lee, I'll start with you. We'll get to what you want to do with vaccines. But what were you able to accomplish in terms of getting to COVID tests to people who need them?
We've been able to accomplish thanks to our partnerships across the U.S. It's been such a unique partnership that I haven't seen in all my years of working in disaster relief. A partnership between a community-based organization like ourselves with the community, the local government, whether it's LA Mayor's Office or Fulton County, as well as the private sector. And it was really sort of in the absence of leadership at the federal level that the counties and the cities have become these incredible unsung heroes, stepping into that void and really taking the reins when there is just an absence of clarity on the testing scene.
Sean Penn, you say that one of the silver linings of this experience with the pandemic, and there are a few, but has been the public-private partnerships. What have you been able to accomplish with CORE, and what are you hoping that this organization will be able to accomplish as it pertains to the vaccines?
Well, ultimately, I'm hoping that what's going to come of this is that we'll have a national guideline, a national plan for service. We've seen in our young leaders that have been recruited and are now running the show so beautifully on these test sites across the country that there's a great will to serve. And once young people serve, it never comes out of their cells. And this service can parlay off into climate issues, forestry, elderly care. There's so many avenues that are opening up in terms of gaps with what we'll find now that the vaccines are coming online. We're going to be looking to, if we can participate in that, we've got our hand up to volunteer to do that. We can, our kind of mega site model as well as our mobile sites are able to get to per site at this stage easily 1,500 vaccines per day. Implementing and administrating at about 3 minutes per patient. So we've been able to identify the zip codes in the areas of operations where we work that get to people where we have 30 to 50% who are uninsured. We're coming up against a CARES Act expiration in December 31st that could really knock us out of the game. So we need a lot of continued private support while we try to keep the feet to the fire of government organizations and appropriations. But we have learned over the last 10 months how to accomplish these things. The millions of people we've been able to offer free testing to. But I think that the global part of it for me is that we cannot, in the best of times, rely on governance alone.
So, Sean, you mentioned the millions of free tests that you all have administered through CORE. The number is actually 3.5 million, which is pretty astounding that you guys alone have been able to do there to supplement the other testing across the country. For people who don't know, CORE started about a decade ago with the earthquake in Haiti, where you rushed in and created an organization and an infrastructure that could do things like it's doing right now. So how do you describe sort of the ethos of that organization, of CORE, and how it applies here to a global pandemic?
We have found that public health offices work at a rate like a freighter. That you need about 22 miles to make a turn. And what our ethos has been is really, if there's a kid in the middle of the street and there's a truck coming, it's going to hit the kid, you got to get that kid off the street and onto the sidewalk. That's the first thing. That's the kind of thinking of emergency response. My concern is that there's going to be too much caution within the organizations that are currently tasked to do the work, and that you'll have a lot of think tanks, and that the epidemic will continue. And again, without the CARES money, you're going to have problems that extend beyond the virus itself and to the economic impact.
And as Sean says, there are some problems, frankly, that are just too big for government, and you guys sort of step into the void as an organization that can help and supplement. So how does that work as a logistical question? You've got the federal government, you have state and local governments doing their best to test, doing their best to administer vaccines. How do you find yourself fitting into that puzzle? Where do you begin?
I think all are needed. Essentially, it's a sandwich approach, right? We need some things coming from the top down, from federal to state to county, but we also need to have that bottom-up approach, and that's where the community comes in. I think what's been so unique about our testing is that we are accessing communities of color who do not have access to the test for free. Because of our relationships, because we are hiring from the communities and the communities themselves are testing each other, essentially we have a relationship and a trust that's been built up over time that has on the ground real sort of operationalization that is very much needed. So it's a top-down and a bottom-up approach, and we provide the bottom-up approach, again, hand in hand with the local and the federal government.
Mike Barnacle's here with a question for you, Sean. Mike?
So, Sean, in this extraordinary health crisis, the worst in a century to confront the United States, the existing federal government has met the health crisis largely with incompetence and denial. And with regard to your operation in Los Angeles and elsewhere, but specifically in Los Angeles, I think I wasn't alone in being struck by the aerial photo of all of the cars lined up at Dodger Stadium. So my question to you is, with all of that going on, the future of CORE and of this country, national service for a year, the country would be much better off. How would you implement this? That's one question. And the second part of it is, who were distributing the shots at Dodger Stadium and elsewhere? Were they volunteers? Were they paid workers? Who were they?
Yeah, so let me be clear that at this moment, what you're referring to as the shots were in fact oral swabs on the testing. But you're right that we want to move into the injections of the vaccination, and we have the logistics in place to be able to do that if we are called upon to do it, or if those running that show see our hand raised to help. What happened is that very early on, the all Peace Corps workers had been recalled from their deployments around the world by the president. That not to come and serve, not with any encouragement to come and serve, but simply to pull them away in a kind of continued nationalism. That allowed them to come on board with us. We began our recruitment with the Peace Corps. We have had a front row seat to see that there's great will among young people to serve. It's simple to train them up quite quickly. They become very dedicated to their work quite quickly. Their leadership skills build quite quickly. And all of these people are hired within the area that we work. So it is all local people doing the work. CORE is a community organized relief effort. It's not, we don't parachute in and suddenly say, hey, we're the man and we can do this. But it is, I guess, again, the silver lining of this for me as a 60-year-old white man of privilege in this country who regrets that there wasn't a demand on me at a younger age to serve. Building that into young people once they have seen that they can make a difference as they do on our sites, it becomes a cellular memory. And when you see that you can be of use, I don't think that goes out of your system, and you build a stronger citizenry. So we're hoping, immediately, our hope is to join the effort to get Americans vaccinated. But ultimately, our hope is to take this experience and to, whether independent or with the government, move towards a culture of service at a young age that solidifies citizenship.
I love that. Sean Penn and Ann Lee, thank you both. And the idea of service is not just helping others, though. It will help the very young people who are participating in that service, which we need. They're struggling in these very tough times. Thank you very much for joining us. Have a safe holiday. And we'll be right back with much more Morning.